Okay, Lisa, take it away.
I don't see the recording button. Oh, there we go.
It's
Okay.
recording. Go ahead.
So, hi everyone. My name is Lisa Honka, and I have a company called Your Key to Senior Living Options. I live here in the Villages, and I started my company 4 years ago because I realized how complicated it was to find resources, independent living, assisted living, memory care communities. I had actually started my career in Massachusetts with Right at Home, working the North Shore of Massachusetts, helping people find in-home care, and then became a director of sales and marketing in a assisted living memory care. Came down to Florida to follow my kids to college, and I worked at Freedom Point and at Atria. And after being here for a couple years, I realized that this was very complicated. And I decided to start my company thinking, oh, I'll help some families and let's see what happens. And the first year I helped 300 families, then 400, and now almost about 1,000 families a year call me. So I'm very blessed to be able to help families find resources. I again, live here in the Villages, and I want to tell you a little bit about what a senior living advisor is. So I belong to a national organization, and we help seniors find and locate resources that make sense for their medical needs, financial needs, emotional needs, location desires. Sometimes people call me and they say, I'm thinking about having surgery and I might need home care. Some people call me and say, I have a husband who has dementia and I think I need a day program, or I need to start with a respite program because I need to go out of state. Or sometimes living in my house has become too much and I might need to move to an independent living, or my parent, my friend, my neighbor, I'm helping them and they need to move to an assisted living because they've just had a medical event, a fall, a stroke, a hospitalization, and now being at home without their family might be too much. So I help seniors navigate and figure out what resources are out there. My services are completely free. So when people call me, they never get a bill, they never get charged. My services, almost like a council on aging, right? People ask questions and I answer them and try to point them in the right direction. I'm actually paid by assisted living, independent living, memory care communities if someone moves in. But I would say only about a quarter of the families that I work with actually move into any community. But I like to be a resource for everyone, whether you have money or no money, whether you'd like me to look at your long-term care insurance, or just years before you're beginning to think about that, what do you need to get in line? So what I'm calling this presentation is getting your ducks in a row, right? So just knowing what resources are out there. Who is your support system going forward, even now? So a lot of people that I work with begin to sort of find things on the internet. Now, my website is on the internet, and sometimes people do find me by looking up Senior Living Advisor. But I want you to be very careful not to go on the internet and never give anybody your contact information. So, for instance, if you were searching on a place for mom or caring.com, your information is owned by them for your life. You cannot turn off their services. They send your information out to a 50-mile radius, and you're going to be bombarded by calls. People who have never been in this area at all, don't even live in Florida, have no idea what resources are here, are going to get your information and send it out to local advisors. The one to local senior living, independent living, assisted livings, or memory cares. The problem is they have referral contracts with only some of the communities. So your ability to look at all resources is limited by their contracts. I have referral contracts with all of the communities, which makes me very different than my competition or even those internet searches. So I encourage you never to go on the internet and search for senior living communities, because there's a lot of things that are happening behind the scenes. They're being purchased, they're being bought, they have different management changes over time. And it's very important that you know what is currently happening, and that's where a senior living advisor can come in and help you. So let's go on to the next slide. So my whole goal in working with seniors is simplifying the search process for whatever you're looking for, whether it be home care, whether it be respite care, whether it be looking for perhaps a senior living community, maybe even again, respite for someone who's going out of town. I want to be that resource. There's even hospice agencies that I work with. I want to help you instead of you getting on the internet and searching around. I'd like to give you the resources, and that's why my whole goal is really simplifying the process for families. Because typically, when families contact me, they're in some sort of crisis. So let's go on to the next slide, please. So figuring out the resources you need is like putting together a puzzle, a very complicated puzzle, because again, typically you are in some sort of crisis. Perhaps your adult children are navigating for you or for a friend, and it's very complicated in that moment to really pull all the pieces together. And it's taken me a long time. I've been doing this right here in this area for over 6 years, but as a working with seniors for almost 15 years. There's a lot of pieces and parts, and it's really important to, again, find resources for families. And my goal is always to keep them safe medically, financially, emotionally, as they transition and make decisions for their care and safety. Next slide, please. So when you're trying to figure out what is out there, it's important to be proactive, talking to family, talking to friends, attending events like this, do your research, get organized, don't ignore little issues, right? Financial issues or medical issues, and talk to experts. That's really one of the most important things, is to talk to the experts. I've done many, many classes on my website. So you'll see it down there in the corner, Your Key to Senior Living Options. If you're interested in looking at my website, there are many classes done by wealth managers. I've done them with the TLC, Transitional Life Counselors. I've done them with mental health specialists. I've done them with the Alzheimer's Family Organization and Alzheimer's Association. So there's many, many pieces of information there that you can click and save and look at with your children, send them to your children, send them to friends. There's probably about 40 classes there, Zoom classes that I've done. So I encourage you to look on there and get some information. Again, they're PowerPoint presentations and they are with local experts. Go ahead, next slide. So right now what we're going to talk about is getting your ducks in a row. I want to give you an overview of what is the things that you need to get sort of in line, but also an overview of what is an independent living, assisted living, memory care, why do people move there, and also what is the cost of some of these communities and how people look at paying for them if they ever need that. Okay, next slide, please. So we all know things happen and the what ifs can happen at any time. If something happens to you or your loved one, are you prepared? So many times I work with families who may have a demented spouse, and I say to the one who is the caregiver, what is your plan? What is your 2 a.m. plan if something happens to you in the middle of the night, you're in a car accident, and suddenly someone needs to navigate for your loved one, and it's not you, right? You've had a heart attack, a stroke, car accident, you've gone up to the hospital, and then you're gone up to a rehab. You may be gone for 3 months. What's going to happen to your loved one? Have you looked around? Do you know what resources are out there? So we're talking about making sure that we get the what if plan. Go ahead, next slide, please. So what are the major catalysts for moving to a senior living community? The number one is actually socialization. So as we've seen during this pandemic, how debilitating sometimes social isolation can be. People move there because their friends have moved away, their family is far away, and they just want to be social again. But being in their home has become very isolating. Sometimes people move there for medication management, meal preparation. We know it's sometimes hard to make a balanced meal night after night. year after year when we're all alone. So sometimes people move there for meal preparation and getting balanced meals. And sometimes they move there for help with activities of daily living, which are help with bathing or dressing, help with managing their medications. Some people have had surgeries and they move to an assisted living as a short-term respite in case they are not able to handle, again, showering or dressing, and they need just a little tender loving care around them for a couple weeks or a couple months until they're able to return home. Also, as people have issues with their eyes, macular degeneration, glaucoma, they often give up driving, right? Or even when they have dementia, their vision is impaired, their periphery vision and their reflexes are impaired. And sometimes they are not able to drive anymore. And so transportation to appointments is another catalyst for moving. Also, people, especially me, don't like doing yard work. So that's one of the catalysts because they're tired of doing the housekeeping, the upkeep of the laundry, upkeep of the house, and all the expenses that go with it. And sometimes they're moving to a senior living community to simplify their lives and have more fun. And also sometimes it is because of caregiver burnout. So as we're caring for a spouse who may have had has a terminal illness or dementia or has a very serious medical condition, sometimes caring for someone that has a very serious illness becomes too much. And the journey is very long. And at some point we sort of lose our focus on ourselves because all that we're doing is caregiving. And sometimes you have to put the line in the sand and say, I may not be able to do all that the experts can do for socialization there, for managing medications, for activities. And some people move to a senior living community because of caregiver burnout. Next slide, please. So medical conditions that are catalysts for move. So 75% of the residents in independent living, assisted living, memory care have high blood pressure. They have Alzheimer's disease, heart disease, they're experiencing depression. And we're seeing that now more than ever because of the COVID pandemic. And many of them have arthritis that makes it difficult for them to move. And the pain that they have with the arthritis makes them, again, a perfect candidate for an assisted living where someone can help them with getting dressed and managing getting in and out of the shower so that they're safe. Next slide, please. Some of the other catalysts are osteoporosis, diabetes, COPD, and cancer, and then also post-stroke. So again, these are just some, as you meet people and people are thinking, I might not be able to stay home as long. These are some of the medical conditions that make moving to a simplified senior living community a little bit easier on people if they've had these diagnoses. Can you go to the next slide, please? So as we're seeing during COVID, these are some of the different symptoms that we're seeing as people are beginning to, now that the pandemic, people have gotten the shots, are looking to perhaps move. And we're seeing more and more people that are deconditioned now. They haven't driven for a year and they're feeling unsafe to drive. They're having some breathing issues past COVID, immune issues. They're falling because, again, being deconditioned, they're feeling very isolated and alone. They have depression issues. During that pandemic, they may have lost a support system or their spouse during that period of time, and they're not able to manage their home finances, meals, medications, and appointments, and they're moving to senior living communities because it's becoming more difficult to be at home after the pandemic. Go ahead, next slide. So where is senior living, where are seniors moving from? They're actually moving from their own home or apartment. They're also moving from a rehab stay. They're moving from an independent living to an assisted living, and they're also moving from being with their adult children. So what choices do I have and how do I make them? So as you're looking at, the first thing is, where do you want to live, right? Do you want to live with family? Are family going to come and live with you? Are you going to be living with them? Am I going to be able to be managed in my own house safely? Will I have to bring in support? So these are some of the questions that I start with is, where are your adult children? Where's your support system? Where's your spouse? And where does everyone live? Because sometimes it makes more sense to move near an adult child because they're not able to come down and care for you if you have medical conditions. Next slide, please. So what is available? So I'm going to go through what is an independent living, assisted living, and memory care. So an independent living, I think we're on the next slide. Oops, sorry, let's go back. So an independent living, these are the 3 different options for, again, a place to live, and we'll go through those in a minute. The next slide is about how do I pay for it. So we'll go on to that one. So when people are thinking about how am I going to pay for perhaps senior living community or even home care, we start to talk about their monthly Social Security, their pension, their savings, if they're going to be selling a house or staying in their house, do they have long-term care insurance? Are they a spouse of a veteran, or are they a veteran themselves and they could get the federal pension called aid in attendance? Are they thinking of going on Medicaid because the finances might not be there, and the spouse has some medical conditions that may be so catastrophic that even paying for an assisted living or memory care is beyond the finances that they have? Also, some people look at accelerated death benefit. So I have a family that I'm working with right now. He is in the hospital, he's in a rehab, and he is end of life. He's had a massive stroke, and they don't have cash, but we are actually going to perhaps turn in the life insurance policy early so that she has cash for his care. There's also life insurance settlements where, again, if the policy is coming to the end, never let your life insurance policy lapse. If you have any issues, give me a call. I have some experts that can go over your life insurance policies and see if there's any cash value in those before you let them lapse. Sometimes when you're coming to the end of the life insurance policy and someone's sick, you may again find a buyer for that. So again, I'm just a resource to try to help you find some cash, and I do have experts that can kind of walk you through that. So again, never let your insurance policies lapse. Or if you're thinking about changing your long-term care policy benefits, give me a call first so I can walk you through the costs, what the value is now, what the value could be if you change the policy. It's really important. I have many 80 and 90-year-olds that say, well, I just can't afford the policy. Well, unfortunately, now is the time, very close to the time in which you're going to need the policy. Now is not the time to get rid of the policy. Now is the time to find the money for the policy, and make sure that you have that, because it could be a tens of thousands, if not hundreds of thousands of dollars that you're walking away from, and we've got to make sure that you can afford it. Okay, next slide, please. So when I'm thinking about national averages, when someone's moving to an independent living, they're typically their national average about 38 months, assisted living 21 months, memory care about 17 months. And these numbers seem rather small, don't they? When everybody thinks, oh, I'm moving to an assisted living and I've got a budget for 5, 10, 15 years. Well, actually, when people start to make that move, they've already had many medical conditions that make them more susceptible to falls, infections. They've kind of burned out their spouses, their adult children. They've had caregivers. And so if you look at the timeframes, the stays are not that long because people wait so very long at home. And it gets to a critical point that they actually have to move to a community as opposed to wanting to move. The average age of a resident living in these communities, independent living is about 80, assisted living is about 86, and memory care is about 85. How long should I budget for? So again, these are national averages. Post-COVID, this is the life expectancy. So again, looking at these numbers and then looking at how long would someone be in one of those communities kind of matches up for the last 1.5 to 3 years of someone's life. Next slide, please. So what is an independent living? So let's start with just ground zero. So an independent living has a hotel license. They are not there to provide care. It is community living. It is a non-medical setting. So they are not there to help with medication management. They're not there to help with helping getting in and out of a shower, helping get dressed. They think of it as a hotel. You are moving into a hotel or an apartment community. They provide meals, they provide housekeeping, they provide transportation and socialization, but they are not there to provide any activities of daily living. So if you have dementia, if you need help getting in and out of a shower, managing your medication, you should not be in an independent living. That is beyond what they can do. They will come and see if you need anything, and then they're going to call your family and say, okay, what's the plan? But they are not going to assist you with any activities of daily living or medication management. We'll go on to the next slide. What is an assisted living? So again, it's community living. It's oversight of your medication, so they can order them, make sure there's no drug interaction, distribute the medication. There could be a nurse in the building up to 24 hours a day, but sometimes they're there only 8 to 5, 7 to 11. They might not be there on the weekend. So it's important to understand what each of the assisted livings have as their medical team, and at what times is that medical team in place. They are there to provide assistance with daily living, so assistance with bathing, dressing, grooming, escorting, and med management. In the state of Florida, we're a little bit different than any other state. We have 3 levels of licenses of communities for assisted livings. That's the standard assisted living license, a limited nursing services license, and extended congregate care license. So a standard assisted living is what we all kind of think of as everybody moves in, you just need a little help with the medication management, maybe showering. But if you're medically complicated, you're a diabetic, you're on oxygen, you have perhaps a nebulizer, you have a colostomy, you have a Foley catheter, you need eye drops constantly. This is not a standard assisted living protocol. That is not what they manage. You need a higher leveled licensed community to manage complex medical issues. And it's important as you're beginning that search to know which communities can do the higher level care and who does it well. Just because they have the license doesn't mean that that executive director or health and wellness director want to take on that. Sometimes they have the license, but they may not have the team or the skill set to do that. So again, it's really important to work with a senior living advisor to know what resources are out there and what communities can manage what care. Okay, going forward. So what is a memory care? A memory care community is a secure neighborhood, meaning that the doors lock, that they have round-the-clock 24-hour assistance, that they're doing hourly to every 2-hour checks on the residents that live there. It's community living, it's medication management, it's nursing oversight, and it's extensive help with activities of daily living. They don't even ask you if you need all of these things. They assume that you do need all extensive care at some point in your stay there. So they will, again, work on a care plan for you, but they will assume that at some point you will need full care and that they're there to provide that full extensive activities of daily living for someone who lives in a secure and protected environment. Next slide. I do have quite a few pieces of information, Zoom calls on my website. So I encourage you to go there. And if you're interested in signing up for our newsletter, I do send that out once a month, and we have many experts that come on my show, and we do that twice a month, and you can hear about some more of the classes. So I encourage you to go to my website and sign up for that. These are some of the classes that we have now: support groups, Savvy Caregiver Workshop, mental health, Zoom seminars, what legal documents do I need? Those are all there on my website, and you can pick and choose the different links and listen to those in your home. Let's go on to the next one. So as we talk about what circle of support do we need, of course, our legal support, our financial support. We need pre-planning for, again, burials, senior living advisors. We know we need our doctors and our specialists. I see you taking a picture, Deb. You like my little video? End of life and emotional, right? So again, this is our circle of support. And I encourage you all to kind of think about this. There is on my website a downloadable version of all of this, right? So if you were to have a one place to find all of the things that you would want your children to know about, your medical needs, your financial needs, who are your emergency contacts. On my website, you're able to click on to this info packet that I have there, download it, and fill it out so that your family has that. Okay, next slide, please. So as we're thinking about our legal, these are things I really want you to think about right now. Have you had your legal papers updated in the last 7 years? Who is your healthcare proxy? Who is your power of attorney? Who is going to be involved with your end of life decisions? And do you trust that person still, right? Is it 2 people? Is it 1 person? Is that person local, not local? So again, I want to make sure that your circle of support is there. Who is, again, who has done your legal papers? Have they been updated? Do you have these all at your fingertips if you need to use those because you're going into an assisted living short term, or if you've had a hospital stay or going to have a hospital stay, make sure that your legal papers are all updated. Next slide, please. So again, medical decisions, do you have your advanced directives? Do you have your healthcare proxy? Do you have your HIPAA authorization form all organized? And do you have a do not resuscitate? What are your end of life decisions? Have you made those decisions? Have you voiced those decisions with your family so that they know how many extraordinary means do you want them to intervene on your behalf? Next slide, please. So again, as you're talking to your children or your healthcare proxy power of attorney, know what your home value is, know where your savings is, your investments, know if your loved one was in the military and where their aid and attendance, their DD 214 is. So in case you want to tap the federal pension aid and attendance, you have that paper, the discharge papers, the DD 214. If you have long-term care insurance, make sure that you have the information about the policy and make sure that your adult children, if they had to navigate for you in an emergency, the long-term care insurance has their name and that you've authorized them to activate that on your behalf. Make sure that your children know what your Social Security is per month. Again, they may have to navigate for you in an emergency, and you want to make sure that they fully understand what your assets are. They want to know where your pension is. If you're thinking about Medicaid, have you done the pre-planning with a Medicaid attorney? Again, if you need any information on that, I can help you with that. Or if you have a disability benefit from either the VA or from the state, like an SSI, make sure that you share that and make sure that you document that. So again, if anybody had to make a decision for you, they fully understand what your assets are and how to move forward. Next slide, please. So in an emergency, where do funds come from? They come from Social Security, pension, savings, sale of a house, long-term care insurance, aid and attendance, Medicaid, accelerated death benefit, life insurance settlements, sometimes reverse mortgages or home equity loans. Sometimes people get a short-term home equity loan because they know that they have a $300,000 or $400,000 life insurance policy on their spouse and they need money short-term. So again, this is just some options for where do we get money, again, in a short-term for a respite or home care, or for if you're planning on moving to a spouse to a assisted living or memory care, where would you get funds? So it's important to kind of think of that again years in advance. This is an example of Joe. So he has severe memory loss. His wife is thinking about having him go to a memory care community. His Social Security per month is about $2,500. He has pension of $500. We're looking for him for a shared apartment in memory care just to save on cost because the wife is staying home. The cost for the memory care, all inclusive of care, is about $4,500. The income per month is $3,000, there's a gap of about $1,500. We know that in Joe's 401k, he has about $75,000. So we take the $75,000 divided by the gap of the 1,500. We know we have 50 months worth of money divided by 12 months is about 4.16 years. So that's just some quick math on, how I look at financially, how people can afford things, where money would come from. Next slide, please. This is an example of Mary, who's 86 years old, and she is thinking about moving to an assisted living. She has Social Security of $2,000 per month. She'd like a 1-bedroom. The cost per month on average is about $3,500. We're going to add in 2 levels of care, which would be about $500, bringing her total cost to about $4,000. So we know her income is about $2,000. She has the cost is going to be, again, $4,000. There's a gap of $2,000. But when she sells her house, she's going to have about $200,000, and she has $25,000 left in savings. So we're taking her total assets of $225,000, dividing it by the gap of $2,000, and we know with this, she has about 112 months divided by 12 months in a year, gives her 9.3 years worth of money. So this is just quick math so that I know that Mary, who's 86, is going to have money all the way out to the time she's 95. As I said, it's better to be 5 years too early than to be 5 minutes too late. So that's why we're talking about getting our ducks in a row. Next slide, please. So where do we start? So when I start with families, again, I start asking them where's their desired location to live, the current medical conditions. We look at the finances and possible finances into the future. What's your wish list? What do you like to do for fun? What are your hobbies? What haven't you done for a while that maybe you'd like to do? Next slide. We look at options such as, again, understanding what levels of care are out there and what levels they might need. When someone moves to an assisted living or a memory care community, we get a document called an 1823 from their primary care physician. This lists all of their medications, their diagnosis, and what activities of daily living they might need help with. This can only be done 30 days prior to a move. So if you're thinking about, again, a spouse moving to memory care, we want to make sure that you've seen the primary care physician 30 days prior to a move. We get an assessment done by the community. Once you decide which community it is, they decide the care plan based on what that 1823 says and also what you say you need help with. We get all the paperwork finalized and we make sure that the care plan is in place. One of the things that I really pride myself in is trying to figure out what services you might need once you even get to the assisted living or to the memory care. Many people don't realize that they're eligible for Medicare days for therapy, physical therapy, occupational therapy, speech therapy, wound therapy, swallow therapy. And so one of the things when I'm looking at a potential resident that's going into an assisted living or even sometimes an independent living, I want to make sure that that community knows, hey, we want to tap into perhaps getting some therapy in place for 8 weeks so that this person has the best opportunity to learn their apartment, learn safety techniques in their apartment, build up their stamina, get as strong and as healthy as possible in those first 8 weeks. And so I really try to make sure that they understand, are we going to need to get hospice involved at some point? Is this person already on hospice? Does this person need therapy? And almost like case management, making sure that they truly understand the goals of this person and where maybe they can tap into some extra therapy paid for by Medicare. Okay, so every time a senior falls into crisis, it takes a toll on everyone. The time to plan for crisis is before it happens, not after, because you're in a crisis and you're on pressure to find information and you're on overload. So one of the things I can do is help you make a plan for you or a loved one. I've helped hundreds, if not now thousands of families finding the right independent living, assisted living, memory care, and I can help you find resources in the area to keep you safe at home, but also, again, if you ever do decide to make that transition, even for a short term, I can help you find ones that make sense for you. Next one. So again, I simplify the process and my services are free. So I just want to thank Maureen again on the back end for helping me. She's amazing. And thank you, Trish, and also Donna for inviting me to do this presentation. Are there any questions, concerns? Was this helpful? Did anybody learn anything? Was it helpful? Okay. Did I go too fast or was it okay? No. Okay. Well, I really love what I do. And so I'm here just to answer any questions. It looks like Lois has some questions. Maureen, can you unmute her?
I unmuted.
Oh,
So
thank you.
Thank you so much. This has been so helpful. And as soon as the recording becomes available, I will make my husband sit down and listen